All right, so I know GI is long, but we are going to start in the mouth, okay? We're going to start in the mouth. That's where mastication and all of that begins. That's where our GI system begins. So we're going to start in the mouth, and we're going to talk about dental caries first and foremost, okay? Dental caries, an erosive process, okay? Erosive process due to bacteria and carbohydrates, okay? And they produce acid, all right? The acid dissolves the enamel on our teeth, the protection, okay? Causes of this: dental plaque build up, poor oral hygiene, all right? Some medications and all of that can play a part, some illnesses and disorders. So knowing all of that, we want to encourage proper brushing at least twice a day, flossing, regular dental visits, okay? Teaching as well. If they do have an illness or a drug or anything that could be altering their oral hygiene, then we need to tell them, like, okay, you may need to increase this, okay? You may need to increase your brushing and your flossing, okay? Because you're already at risk, right? And we know that if somebody has dental caries or something is going on in the mouth, they're not going to want to eat. They have loose teeth, gingivitis, swollen gums, sores, or anything in their mouth, they are not going to want to eat, right? It's going to make it very hard for the mastication process, right? Another thing is candidiasis. Okay, this is a fungal organism. Okay, fungal organism in the mucous membranes in the mouth. All right. What this looks like, you guys have probably heard it as thrush. Okay, thrush, the white, pearly, milk curd looking stuff in the mouth and on the tongue, and the membranes, like even like in the back of the throat. It could be like patch-like. Okay, and then if it's removed, it can bleed and hurt really, really bad. Okay, it also has a poor odor. Okay, it gives soreness and difficulty swallowing. So, are you going to want to eat? If you have difficulty swallowing, would you want to eat? No. And this is a domino effect, right? So, if you don't eat, then how is that going to alter your nutrition and everything, right? So, again, it begins in the mouth. Okay, that's another reason why we started in the mouth. Okay, some medications that could be prescribed for candidiasis is antifungals. Okay, antifungal medications. There's this swish and spit or swish and swallow called nystatin. That's one that could be given. Making sure that hand hygiene is key. All right. Soft bristle brushes, because a hard brush is going to hurt. And again, if that comes off, that white curd looking stuff inside the mouth from the candidiasis, that gets brushed off or peeled off or scraped off, is going to bleed and it's going to hurt. Avoid hot foods. Avoid anything that's too cold, spicy, fried, citrus, anything that's going to aggravate it. Okay. A topical anesthetic can also be provided at least 1 hour prior to meals to make it easier to eat. Okay. And then lastly, we're going to touch on like carcinoma of the oral cavity. Okay. Some risk factors of this is tobacco usage. Okay, chewing tobacco and all of that. Not just chewing, but that's a common one, right? Alcohol, sun exposure, HPV, and then leukoplakia as well. Those are all risk factors, okay? Leukoplakia, this is white, firmly attached patches in the mouth or the tongue. That's what it appears as. It is asymptomatic at first, and then the area starts to become more rough, right? The very first complaint is usually the difficulty with chewing and the difficulty swallowing, and then it can eventually affect like your speaking in your voice box, okay? It starts to swell and get very numb, and then you have a loss of feeling in that area of the mouth, wherever it is, okay? You may also feel like an earache, facial pain, toothaches, okay? Some medical management surgery. Okay, again, this is cancer, carcinoma, right? This is cancer. So surgery, it may have to be surgically removed, okay? Depending on how the sizing and all of that, and also the progression. I think even if it is small, it will still be some form of procedure to remove it, okay? All right, I think that's it in the mouth, and then we'll get to GERD, okay?